everyone. This is a small awareness regarding the coccyx or coccydynia, the tailbone pain. We have Mr. Piyush who is from the IT background. Yes, आप बता सकते हैं what was the problem when you came to us?
Yes, doctor. So when I came to Dr. Shailesh, I was suffering from acute tailbone pain, and this was a condition which I was suffering from for the last 4 to 5 years.
4 to 5 years, okay.
I was not able to sit properly, I was not able to lie down properly or sleep properly, and at times I had issues standing straight as well. And as you told, sir, I am working in a software company.
How was you sitting when you used to go to office for these 4 to 5 years?
There were different phases. There was a phase where I was sitting, in a tilted posture, or sometimes, not taking the right back support, with my hips a little bit slanted towards.
Okay.
And then there was a second phase where I started using the coccyx pillow. Yeah, but that was also not too comfortable.
What all things you did in these 4-5 years?
I consulted a lot of doctors. That was the first thing. I consulted a lot of doctors. They recommended me painkillers, a lot of vitamin D, B12, and coccyx pillow. I also did some physiotherapy, but none of them really helped.
Okay. So now how are you feeling?
I'm feeling really great. It has been 1 month since the procedure happened, and I feel my pain has gone around 90%. I'm really back to my normal routine. I can really sit for long hours.
We did the coccyx pain block and the manipulation, that's MUA. So I think this is very, very important. Someone who is suffering, who cannot sit for long in office, or pain in the tailbones where we normally sit. And this is what I just want to show, that this is the spine and this is the tail part where we normally sit. And there was small angulation, and there was a coccyx which was getting, the ligaments were getting trapped. What this condition is called as coccydynia, where there are persistent bone over the tailbone, where the spinal bone ends in the lower part, and it's a very uncommon area for having a problem to most of us, and something which we don't like to talk to people, and therefore we try to hide. We take some painkillers, we go to various specialists. Normally what we would like to tell is, this is a self-limiting condition. If you do good physiotherapy and rehabilitation, you can get better. Surgery is not the option for this. Normally this is a condition which can be treated with conservatism. But if the patient is not getting better over the period of time, something called as coccyx pain block and manipulation is the way to go. There is a good evidence to support this procedure worldwide. Around 70%, 75% people can get better with this procedure, and it's a day procedure. It's not something which is like a surgery. This is not a surgical procedure. And don't suffer. Go to a good specialist in your area where you live for getting better from this problem. And then you need to continue for a good rehabilitation once this pain blocker starts working. Thank you, Piyush, for helping us. How did you come to us?
Yes, doctor. So that's also a really good story. My mother was suffering from a cervical pain, and someone referred her to you.
Okay.
And you were treating her, and we really liked the way you were treating her, the improvement she was experiencing. And then I thought that I had given hope with this coccyx pain, but then I thought I should give it a try with you as well.
Okay.
You were the first person who told me this could be treated. You told me that in the first meeting, and I thought, yes, I'll have to go with what the doctor is saying.
Yeah, always it's that we have to try something to make our patients better. Thank you, Piyush, for giving us time today for this awareness initiative. Thank you very much.
Thank you, sir.
Thank you.